if an individual parent, grandparent, or even a student is thinking, I want to play a role in the health system in the future. We hear about the nursing shortage, different regions, we hear about the therapist shortage. If you were talking to somebody, whether in high school, college, or even younger right now, to say, here is going to be the greatest need 10 years from now when it comes to care delivery, at least in the regions that you're managing hospitals, what would you share with them about what to get training in?
Yeah, wow. That's an awesome question. Let me share a little story with you about
Sure.
Providence and something we've done that we think can be applied to your entire question. So we started several years ago the Nursing Academy at Providence. And the idea was when nurses were coming out of college, we didn't really have a way to train them in the Providence way. And so we created this academy. So if I'm getting out of school and I want to be a med-surg nurse, we'll train you on that. 3 years
Sure.
later, if you're with us, I'll train you on it, being an ICU nurse, et cetera. And what's been really remarkable since we started it, we've had 7,000 nurses go through it. The stay rate with our organization has been threefold.
Wow.
They'll stay 3 times longer than somebody who walks off the street. And probably the coolest thing in the environment we're in and the worry about the aging workforce and all that, the average age of an RN in Providence has gone from 51 to 43 years old.
Wow.
And so that's a good thing.
Yeah.
And so what we're trying to do is apply that to what we think are the future jobs in healthcare. The first thing I would ask people is really what is their interest? Because if you're somebody who wants, things moving fast and all that, ambulatory surgery center business will always be there.
Yeah.
It'll consolidate. One of my biggest worries that I think as a country we're not ready for, and that is Alzheimer's. Sure. We did a study of where we thought all the DRGs in the hospitals would be in 5 years. We think up to 52% of them will be gone.
Wow.
They'll either be in a drug therapy or they'll be in a ambulatory setting. But the one that we're really interested in understanding is, will there be a day where Alzheimer's is the number 1 cause of death in this country over heart disease and cancer? And we have many, many communities when we've looked at the demographics that are they're poor seniors that are single. And I went through, my father passed away from Alzheimer's, and that is a hard thing to go through. My mom was lucky the resources she had, and that she was connected to Providence and get the kind of care my dad needed. So I think if you look to the future, I think people that really want to work in that particular space, it's hard, very, very hard work. But the people I got to personal experience in that are some of the most incredible people who have the most wonderful careers you can imagine. So, I think that's an opportunity. I think technology, I think the use of AI, from everything on how we predict what the census of our hospitals can be tomorrow to reading, images, and x-rays and all that. So it really depends whether you're more of a technical innovator. Those are the areas I'd go into. If you're deep in your soul caregiver, I would focus on what I think is going to be the biggest need for this country. And that is, I think, end-of-life care, particularly related to Alzheimer's.